Welcome to this training session designed by Environmental Management Consulting to help educate you and make your workplace a safer and more productive environment. In the US, millions of people are infected with bloodborne pathogens such as HIV, hepatitis B, and hepatitis C. In a school environment, there are numerous exposure risks for employees, including assisting an injured coworker, helping administer first aid, or cleaning up a blood or body fluid spill. In this training session, you can expect to learn about OSHA's bloodborne pathogen standard and your organization's exposure control plan, what types of diseases can be contracted, and the modes of disease transmission, exposure prevention strategies and techniques, including universal precautions, engineering controls, administrative controls, and personal protective equipment, and how to react in the event of a bloodborne exposure incident. The Bloodborne Pathogen Standard, as created by the Occupational Safety and Health Administration, or OSHA, outlines safeguards to protect workers against health hazards from the exposure to blood and other potentially infectious materials, or OPIM. All employees who could be reasonably anticipated to contact blood or other potentially infectious materials as part of their job duties are covered by this standard. Good Samaritan acts, such as assisting coworkers with a nosebleed, are not considered occupational exposure. Even if your job duties are not covered by the standard, the safety precautions for dealing with bloodborne pathogens are beneficial for everyone. An exposure control plan has been implemented to help minimize or eliminate workplace bloodborne injuries. These injuries can occur from needle sticks, cuts from contaminated sharp objects, or from contact with contaminated blood. Your employer must provide training about potential bloodborne hazards. Training for occupationally exposed employees must be performed on an annual basis. A plan manager has been designated to administer this program. Please contact this person directly with any questions you may have, if you would like to review your written program, or if you have any concerns regarding a possible exposure. So, what exactly is a bloodborne pathogen? Simply put, a bloodborne pathogen is a pathogenic microorganism present in human blood and can cause disease in humans. Bloodborne pathogens covered within this standard are HIV, the human immunodeficiency virus, HBV, the hepatitis B virus, and HCV, the hepatitis C virus. Other potentially infectious materials, or OPIM, include human body fluids such as sexual fluids, cerebral spinal and pleural fluids, as well as any other body fluid visibly contaminated with blood or fluids where it is difficult to differentiate between body fluids. Acquired immunodeficiency syndrome, or AIDS, is a recognized infectious disease in which the body's immune system is damaged. This disease can cause those with AIDS to be vulnerable to a number of serious, often fatal, opportunistic infections and cancers. The earliest known case of HIV occurred in the late 1950s. Since that time, the number of HIV-infected people in the United States has continued to grow every year. Recent advances in the medical field have delayed the onset of AIDS for people infected with HIV. In addition, treatment strategies have significantly lowered death rates for individuals with AIDS. Like hepatitis, people with early-stage HIV can live normal, seemingly healthy lives for years without knowing that they are infected and still be contagious. Symptoms can develop as soon as a few weeks, but may take up to 10 years or longer. Common symptoms of HIV include fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, and ulcers in the mouth. Another bloodborne disease of concern is hepatitis B. Hepatitis B is a virus that attacks the liver. The virus can cause a lifelong infection, cirrhosis of the liver, liver cancer, liver failure, and even death. Hepatitis B, like other bloodborne pathogens, is spread when blood or body fluids from an infected person enters the body of a person who is not infected. The hepatitis B virus is a very durable virus that can survive outside the human body for up to 2 weeks. The hepatitis C virus, or HCV, also causes liver disease. Most often, HCV is transmitted through injecting recreational drugs. However, blood transfusions prior to 1992, mother-to-child transmission, and needle stick exposures are also possible modes of transmission. Unfortunately, many people with hepatitis B and C do not have symptoms and do not know that they are infected, and they can still spread the virus. If you do have symptoms, they are usually mild and flu-like, such as fever, fatigue, loss of appetite, nausea, vomiting, and abdominal pain. You can also have more obvious symptoms like dark urine, clay-covered bowel movements, joint pain, or jaundice. These symptoms may appear as soon as 90 days after exposure or may not appear until 20 or 30 years after exposure. A bloodborne pathogen can only infect an individual when infected blood or other body fluid enters the body of the non-infected person. This exposure incident can happen in different ways. Examples of direct exposure to employees include shared needles and razor blades, accidental needle sticks or cuts from other contaminated sharp objects, and direct contact with open sores or blood, even if the blood is dried. According to the CDC, bloodborne pathogens are not spread routinely through common contact, such as sharing food or water, sharing eating utensils, hugging, holding hands, coughing, and sneezing. Are there occupational exposures to bloodborne pathogens in your workplace? Do you know what to do if you encounter a body fluid? To this point, you have learned about OSHA's bloodborne standard, as well as some diseases that can be transmitted through exposure to blood or body fluids. This section will discuss prevention strategies and techniques to protect yourself from bloodborne pathogens in the workplace. Universal precautions is an approach to infection control used to protect employees from exposure to all human blood and OPIM. This means workers should treat all human blood and certain body fluids as if they are infected. Even elementary age students can be carriers of bloodborne diseases. Universal precautions is the best way to minimize workplace exposures. Engineering controls such as proper hand washing, safer needle devices, and proper sharps disposal must be implemented. In addition, administrative controls such as annually reviewing the exposure control plan, communicating the plan to all employees, and reporting unsafe work procedures will help reduce exposure potential. Hepatitis B vaccinations have been safely administered to millions of adults and children. The annual number of occupational infections has decreased 95% since the vaccine became available. Individuals whose immune system is compromised should consult their personal doctor before receiving the vaccination. Employees who decline the vaccination are required to sign a written declination statement. If at any time the employee changes their mind, the employer is obligated to provide the vaccination series. Contact your exposure control manager with any questions. Before deciding whether or not the hepatitis B vaccine is right for you, it is important to distinguish between the facts and myths surrounding the vaccine. Myths and misinformation about vaccine safety can confuse people who are trying to make good decisions about their health. There are many misconceptions surrounding the hepatitis B vaccine. One myth suggests that the hepatitis B vaccine is linked to causing neurological disorders or autoimmune diseases. However, vaccination is very common throughout the developed world, and while some of the sickness or reactions that follow may be caused by the vaccine, many are unrelated events that occur simply due to chance. Researchers at the CDC and elsewhere have conducted numerous studies that have been reassuring, providing no evidence to suggest a link between vaccines and any serious health conditions. After implementing and practicing engineering and administrative controls, personal protective equipment, or PPE, is your last barrier between an infectious disease and your health. Disposable gloves, hypoallergenic gloves, eye protection, and other types of PPE must be readily accessible for employees to use when they encounter blood or body fluids. Contaminated needles or other sharps can cause serious injury and possible exposures. If encountered, such objects must be placed into designated sharps containers. Containers shall be puncture-resistant, leak-proof, labeled, and color-coded, all in accordance with OSHA regulations. If you believe you may have been exposed to blood or a body fluid, it is vital that you follow the specific steps outlined in your exposure control plan. If an exposure occurs, immediately wash all exposed areas with soap and warm water. For blood splashes to the nose, mouth, or skin, flush all areas with water. For blood splashes to the eyes, irrigate your eyes with water or saline solution. You must immediately report the exposure to your supervisor and seek medical attention from a healthcare professional. This confidential medical evaluation should be performed by a licensed healthcare professional following CDC and OSHA guidelines. As part of the evaluation, an attempt shall be made to obtain consent to test the blood of the source individual. As a school employee, if the source individual refuses to be tested, you have legal rights to force that individual to be tested for HIV. Remember, always protect yourself. Always assume all blood and body fluids are potentially infectious to you. Know the location of PPE and use it properly every time. Always utilize proper cleanup and disinfection procedures. Wash hands and all exposed areas after any incident. Immediately report all bloodborne incidents. When in doubt, stop and ask questions. Part of your job duties may require you to come in contact with blood or body fluids. It is imperative that you always protect yourself first. Whether it's rendering first aid to an injured student or cleaning up a blood spill, proper planning and PPE are your keys to safety. When you encounter an injured student, encourage the student to apply pressure to their own injuries. If necessary, you can help with basic first aid only after calling for assistance and donning your personal protective equipment. Part of your job duties may require you to come in contact with blood or body fluid spills. Proper cleanup is essential in protecting yourself and other building occupants. When coming upon a spill, a detailed step-by-step process should be followed. First and foremost, make sure you have the right tools and equipment to perform the job. A proper cleanup requires personal protective equipment, an absorbent material, an approved disinfectant, and a container for waste collection. Even minor contact with blood or simple spill cleanups can create a situation where exposure can occur. It is imperative to address all blood and body fluid spills seriously. When handling these situations, remember these simple steps. Step 1. Always use disposable gloves and other appropriate PPE. Step 2. Use an absorbent material or disposable towel to help clean up the spill and help lower the risk of exposure to others. Step 3. Decontaminate all surfaces with an approved disinfectant or biocide. Step 4. Gather all waste and secure for proper disposal. If in doubt, ask for help from other trained staff. Disposable gloves shall be put on before attempting to render first aid or to clean up spills. Remember, gloves can protect you from surface exposures but cannot protect you against penetrating injuries caused by needles or sharp objects. For most situations, disposable gloves and protective eyewear will be sufficient. In rare cases, more protective PPE may be desired. Bloodborne viruses are more dangerous to us when they are in a liquid or semi-liquid state. Applying an absorbent to the spill helps minimize the chance of splashing liquid into your eyes and mouth. It also minimizes the potential of the viruses entering your body through open cuts or sores. Absorbents can be paper towels, rags, or other products purchased by your employer. There are many different types of approved products that are effective against HIV, HBV, and other bloodborne viruses. An approved disinfectant should be applied to all affected areas. Be sure to closely follow the manufacturer's directions. Next, sanitize all affected surfaces completely, including any equipment or tools used in the cleanup process. Allow time for the cleaning agent to effectively kill all viruses. After allowing the disinfectant to work, clean up all bulk material and place into a bag for proper disposal. Take extra care with sharp objects such as syringes or broken glass. Use a disposable scoop, dustpan, or other tool to handle these types of items. Be sure to place such items in leak-tight, puncture-resistant containers. Contact your supervisor if you believe the waste generated is a regulated biohazard waste requiring special handling and disposal. Although each case is unique, a general rule of thumb is that if you believe the waste can release blood or body fluids contaminated with blood that could harm someone else, the waste must be treated as a biohazard. This type of waste must be securely stored for proper transport to an incineration facility. Carefully remove all personal protective equipment after all work is complete. Disposable gloves should be removed with caution as not to cause an exposure to yourself from contaminated gloves. Wash your hands and other affected areas thoroughly with soap and warm water. If water is not immediately available, use disinfecting wipes or antibacterial lotion as a temporary measure until hand washing facilities are available. Now that you are familiar with the bloodborne spill cleanup procedures and how to protect yourself, let's go through a couple of